Well, good afternoon, everyone. And I want to welcome everyone to our November 12th COVID-19 pandemic briefing. Today, I'm joined by Dr. Danny Avula from the Richmond and Henrico Health District. Let me begin by saying that my staff and I have been monitoring ourselves for symptoms, and personally, I'm feeling very well. I've heard from a number of members of my staff who feel well too. And we continue to be in quarantine, and I appreciate everyone adjusting their schedules to be with us virtually today. We are, of course, taking every precaution by working from home, and I will get tested tomorrow. That's what we expect of all of our employees, and it's also what we expect of our residents as well, if you've been exposed to anyone who has been found positive of COVID-19. It's our responsibility. We take this very seriously, and we ask that our residents and those who work for the city of Richmond do the same. So as of this morning, the Richmond City Health District is reporting there's been 5,871 total cases of COVID-19 since the beginning of the pandemic. 78 Richmond residents have unfortunately lost their lives because of this disease. Per usual, I'm gonna ask everyone to join us for a moment of silence for those whose lives have been lost during this pandemic. Thank you. Currently, there are 25 confirmed positive cases within the city of Richmond's workforce, 25 confirmed cases. 57 city Richmond employees are currently quarantined due to direct exposure, and whether to a co-worker or to a member of the public. This includes members of my staff and my office, and also 37 members of the Richmond Police Department as well. Ladies and gentlemen, these numbers are a wake-up call for all of us. This virus is real. I've always said it. I know it's like a broken record, but COVID-19 is real. It's virulent, and it does not recognize family ties or recognize your COVID bubbles. And perhaps most troubling, it latches on to individual actions to infect many, many people, often without the individual even knowing they've been infected. That means one thing for all of us, and that is to get through this, we must think of others. That's our responsibility. There is no other option. Each of us have to take responsibility for our individual actions and also the consequences that come with those actions, whether we see them or not. Let my office serve as an example to all of us. We must stay vigilant, or very soon your world may change with one call from the Richmond City Health District. Dr. Avula, I'm going to say thank you for your team for the work they've done to contact trace, reaching back to all those who we've been in contact with. I know a number of my folks have received calls. I also want to thank the Richmond Fire Department for doing a thorough job as well within the Richmond City workforce in contact tracing this incident that arose out of the registrar's office. For all those out there, I just want to repeat some simple steps that we must continue to take to keep us all safe. As always, we must continue to wear our mask, and we have to continue to social distance. There's no exceptions to this part of the protocols. Just because you see someone regularly does not mean you can let your guard down, period. The self-created COVID bubble is a myth. If they are outside your household, stay 6 feet away and continue to wear a mask. Do not have indoor gatherings or attend large gatherings like weddings or holiday parties. Your social engagement is simply not worth the risk to the people you love. I want folks to continue to pay attention to your symptoms. If you have an itchy throat, runny nose, or persistent cough, don't immediately write that off as simply allergies or the common cold. And as soon as you start experiencing symptoms, please, I ask of you, please stay home. According to OSHA, prompt isolation of infectious persons is vital for both you, your coworkers, and to your employer as well. And if you experience symptoms, please get tested. You can get tested for free with the Richmond City Health District. There are 3 testing events coming up. Monday, November 16th at Parham Road Baptist Church from 2 to 4 p.m. Tuesday, November 17th at the Eastern Henrico Health District from 10 a.m. to 12 p.m. And Thursday, November 19th at the Regency Square parking deck from 10 a.m. to 12 p.m. Remember, these RCHD events are available to the broad public, regardless of insurance, citizen status, mobility, or geographic location. And if it will make you or someone that you've been in touch with feel a lot more comfortable, we request that you get tested. Now I'm going to hand it over to Dr. Danny Avula with the Richmond City Health District for an update on Richmond's health status. Dr. Avula.
Thank you, Mayor. Afternoon, everyone. The data continues to move in the trend that we've shared for the last few weeks. We've had about 43 days now of a consistently upward moving trend of cases in the city of Richmond. We're peaking now at around 43 cases a day, our 7-day moving average of new cases per day. Not quite where we were during our first peak. That was around 52 new cases a day, but I suspect that we will be headed there shortly. There's just nothing to indicate that this trend is going to be reversed anytime soon, as we've been talking about the push to cooler weather and more indoor space, and now with the holidays and more gathering, we likely will continue to see this trend move in this direction. So, what looks different, if anything? We continue to see a shift towards that younger adult age group, so the 20 to 29 age group over the last 4 weeks, again, has predominated our cases. Over 37% of the cases in the city are in that particular category, that 20 to 29, followed by the 30 to 39s. We've also seen outbreaks in adult day homes. So, smaller group homes where adults with developmental disabilities reside. Throughout Richmond and Henrico, we have about 50 cases spread out over about 16 different group homes. And so that's a newer trend. Thankfully, our rates, our outbreaks have stayed relatively stable in our larger nursing home facilities, but that is the segment of our community that I continue to be most concerned about, not only because of the age and fragility of the residents who live there, but also because of the congregate setting, the ability for an outbreak to develop quickly. When we've looked around the country at some of the long-term care facility rates, as you know, much of the country continues to surge in daily case rates. We are seeing in other parts of the country an increase in the number of outbreaks in long-term care facilities. And so, I know that our administrators locally have just done a heroic job of introducing new testing and new protocols and screening staff. A lot of them are using rapid antigen testing now. But I think with the loosening of restrictions at the federal level, with CMS allowing visitation now, and particularly as the holidays come upon us, there will be the potential for new introduction of disease. And our hope, obviously, is that vaccine will come quickly, but I'm still very concerned, and we need to be very vigilant about those particular interactions in long-term care facilities. No real, I guess since we last talked collectively, I've talked to most of you individually over the last few days, but no new information since Monday on the vaccine efficacy. The big headline was that Pfizer's vaccine looks to be above 90% effective. Still waiting for more finalized data on that, but it's very encouraging news. And we will continue our planning and ensuring that all of our long-term care facilities, adult homes, group homes, nursing homes, and assisted living facilities have their agreements set up to get direct disbursements of vaccine when the time comes, still hoping that that will be towards the end of December. So I'll pause there and see if there are any questions.
Thank you, Dr. Avula. What we'll do now is we'll enter the question and answer phase of our regular press conference, regular briefing. And so, Sam, I'll hand it over to you.
Thank you, Mayor. Let's start with Henry. Henry, I'm going to ask you to unmute and ask your question.
Mayor, thank you very much. Glad you are doing well. Could we talk about hospitalizations right now in Richmond and kind of where we stand with that? And is the concern that the virus is just spreading in the community, or is at some point it's going to tax the resources like we were talking about earlier this year?
Yeah, just to be clear, I don't need to repeat the questions here, right, Sam? We're good. Okay.
Correct.
I'm just so in the habit. So yeah, I think that right now we've actually seen, if anything, a slight decrease in hospitalizations throughout the region. We continue to monitor that data week in, week out. And so that's encouraging. I don't necessarily have a great explanation for it, except that because we've seen so many more cases shift towards this 20 to 29 and 30 to 39 age group, they're getting milder disease and aren't requiring hospitalization. So what's the longer term concern is, one, that the ripple effect of just more cases out in the community invariably means that more vulnerable people will be at risk. And so I expect that there'll be a little bit of a lag, but that we'll see that those hospitalization numbers turn around in a few weeks. It's not what we want to see, but I think every time we've seen a peak of disease, we've seen hospitalizations start to increase a few weeks after that. The other concern I think you were getting at, Henry, is really this idea that as we are now in the midst of flu season, the dual impact of people who are hospitalized for the flu and hospitalized for COVID may start to put a strain on our health system. This has clearly been a concern across the country to ensure that we have enough capacity in our hospitals to treat severely ill patients, either with flu or COVID or whatever the case may be. We're a long way from that. Right now, our ventilator usage hovers around 30%, have not seen any wild swings in that number. And so there is currently good capacity throughout our region's health systems to treat those severely ill hospitalized patients. We still absolutely want people to get their flu shots. The flu vaccine will prevent people from getting severe illness with the flu, which will again preserve capacity in hospitals. And I think we talked about this in this venue a week or two ago, but if not, we have seen that the impact of flu around the world has actually been significantly less than it has in past years, in large part due to the mitigation efforts that we're all undertaking, staying home, washing hands, keeping distance, wearing masks. The things that we're doing to prevent the spread of COVID are also preventing the spread of flu. And so that's really encouraging. We've seen amazing data from South Africa and Chile and Australia. My concern is that we have been about the worst country in the world at containing COVID. And so I think that we will hopefully see smaller flu numbers, but I can't look at other country data and expect that will translate here given what we have seen with COVID transmission.
Thank you, Dr. Avula. Laura?
Hi, can you hear me?
Ooh, we've got an echo.
Can you hear me now?
Yes, perfect. Thank you.
Okay. Sorry about that. I was having some microphone issues. So Mayor or Dr. Avula, I'm not sure who might be able to speak to this, but we have spoken with several employees in the Richmond Registrar's office following the outbreak who say they were not provided hand sanitizer or cleaning supplies. Are you able to speak to that at all and what impact that would have?
Well, so the current status, at least with our investigation into the cases and transmission with the registrar's office, we have the registrar's office is reporting 11 cases that are 11 known positives. We're still waiting on lab documentation to confirm those from the health department end, but I think that's a pretty reliable number at this point. We have a couple of individuals who are still awaiting test results. And then now the number as of yesterday afternoon was 20 individuals who have been in quarantine. I expect that number to grow as we identify new positives. So I think, as we have interviewed a number of patients and really tried to understand how some of this transmission took place, I think, the reporting has been consistent that people were wearing masks. However, a lot of the gathering, a lot of the planning meetings, a lot of the training sessions were done in spaces where 6-foot distancing wasn't really possible for the number of people required to pull off some of these events. And so, our best assessment is that while mask wearing was enforced well, that perhaps hand sanitization and 6-foot distancing was not enforced as well, and that contributed to some transmission. I think the other thing that we have seen in this particular case, as we see with almost every outbreak that we work up, is that there were individuals who had really mild symptoms. They had a little bit of congestion or runny nose. They attributed it to their allergies. That didn't preclude, that didn't trigger a decision to not show up to a meeting, and subsequently that they tested positive for COVID and ended up being a transmitter. So I think those core things I will just reiterate. We've got to rigorously screen ourselves from symptoms. We've got to make conservative decisions even when we have mild symptoms to stay home and get tested. And then mask wearing and 6-foot distancing really needs to be enforced. If not, whenever people get together, we're going to see transmission.
Thank you, Dr. Avula. Chris?
Hey, yes, thank you. I want to ask 2 questions of the mayor, if possible. One, you said you're being tested tomorrow, but I was wondering why you hadn't been tested sooner, if we'd known about this for almost a week now. And then second, a bit off topic, but regarding the election office, you've had some candidates raise concerns about the registrar reporting numbers from the vote counts. They were certified yesterday, but in the 2nd district race, you've heard one candidate who the revised numbers, like thousands of his votes, were kind of disappeared. They certified him and then lowered his vote total. Does this concern you at all? Is this something, I know the electoral board and the registrar's office is not exactly in your purview, but is there anything that you can do about it, or you think you want to do about it?
Well, I've been obviously following the election results like everyone else as a candidate as well. I've been following the results. And I will say that I'm glad that there is the ability for any candidate to file a complaint or file for an inquiry into his or her results. I welcome that. I know that helps with the process. It helps to bring an integrity to the process as well. And so I'm glad to see that there's a candidate that's actually doing that. Moving forward, as I've always said about every part of local government, everything is, there's always room for improvement. This is the first time that the registrar's office ever had as many mail-in votes as we've seen, as we saw this year, and also in-person absentee, which all I think it's all a good thing, but we have not perfected it yet. And this is the first time we've ever done it because of the pandemic, but I foresee we're going to be doing this again. And so let's get the process right. Let's create more confidence in the way we run these elections in terms of getting the results actually out timely to the public. And so those are improvements that I've already spoken to the electoral board about. As you stated, it's not in my purview, but I know that they're open to those suggestions. And if there's any help that we can provide as local government, we're willing to do it. The dollars that we were able to invest early on allow for them to have access to the space that they have currently over off of Laburnum. But this is going to be the new way we do things in terms of in-person and mail-in voting. And so I want us to get it right. And the administration stands ready to help if they need so. Let's now talk about my testing. Obviously, I consulted not only my physician, but also consulted Dr. Avula as well. And getting what I hear, and Dr. Avula can speak to it as well, getting a test earlier on in the process may not have caught the virus. And so we wanted to quarantine for a few days. So I've been in quarantine, I think, since Monday. And then I'll get a test tomorrow and see whether or not, I test positive or negative. You want to give yourself a little time to see whether or not there's actually any virus within my body and whatnot. And so I'm listening to orders from my doctor, my physician, but also from Dr. Avula as well. Dr. Avula, you want to speak to that?
Yeah, thank you, Mayor. It is a really important point of clarification that I think would be helpful for people to hear, which is that when you've been exposed, we ask people to quarantine for 14 days. And why is it 14 days? Because the incubation period of COVID is anywhere from 2 to 14 days, which means from the time of exposure, you could have symptoms present as soon as 2 days, but you could have them present as far out as 14 days. And a negative test doesn't free you from a quarantine. And so typically we ask people to hold off on any testing until about 5 to 7 days from the time of exposure. We know that at about 5 days, 50 to 60% of people who've been exposed will become infected and test positive. At 7 days, that number jumps to about 90%. And at 11 days, 98% of people who've been exposed will test positive if they are infected. And so the longer you wait, the more sure or more accurate that test will be. But even if you get a negative test, we still want you quarantined for the full 14 days in case you're a late incubator.
And so, yeah, listening to Dr. Avula, even if I do test negative tomorrow, I will not be free from my quarantine for another while. So it's the responsible thing to do, and I hope that every individual who may have ever been exposed and continues to test negative still follows my lead, and they stay quarantined for 14 days.
Okay, next up is Roberto.
Yes. Can you hear me?
Yep.
Yes, we can.
Okay, got it. This question is for Mayor Stoney or Dr. Avula or both. Has there been a COVID-19 outbreak at the Richmond Commonwealth's Attorney's Office, and has that affected at all their ability to sort of speedily prosecute cases right now?
We did have a cluster of disease at the Commonwealth Attorney's Office. This was a group of employees there that were at a social gathering together. They ended up having 6 people who were positive, who were all part of that initial gathering. It was about 2 weeks ago, so 3 of them have now cleared their isolation period and have returned to the office. We have a couple of other individuals who are on quarantine and will be testing shortly. As I understand it, it hasn't impacted their office operations too much, but you'd probably have to follow up with Commonwealth's attorney about that.
Okay, Melissa, I'm just checking in if you want to ask a question.
Yes, I do. I have a 2-part question. So the many city employees that are in quarantine, including a lot of police, people with the police department, and then the 25 confirmed positive cases, how many of those are associated with the outbreak inside the registrar's office?
I don't know if Dr. Avula can actually speak to that. I know that the ones in my office are connected to the one in the voter registrar's outbreak, because my campaign manager was infected with COVID-19, and I was as well. Well, I mean, I was exposed to it. And so those who were in my office obviously are quarantined because of that incident from the registrar's office. The police department, I can't speak to where that's, some of those I believe have been reported or connected to the registrar's office as well, but some of those are just interactions in the public or in the daily lives of some of the other members. That's as much information that I have to this point, unless Dr. Avula can fill us in with anything further.
Yeah, I don't actually know how we're counting those numbers in terms of the city employees. So I don't know if the employees that are part of the registrar's office are also counted towards the city's numbers or not, because technically the registrar sits in a slightly different category, as I understand it. But many of the employees who have tested positive are just people who have had interactions either in the context of their work duties, like a police officer, or in their home lives. And then because of exposure to a positive individual are being asked to quarantine. And, when you think about any organization, particularly a city government with 3,000 plus employees, a certain subset of that population at any time, given the amount of community transmission we're seeing, is going to be positive, and then there are going to be people who need to be quarantined. So some of those individuals are quarantined as a result of the registrar office outbreak, but many are just because of exposures in other areas of their life.
And then the second part of my question is it possible to have everyone wearing masks? However, COVID could still spread quickly, like we've seen in this registrar's office example.
Well, it's certainly possible when the other hallmarks of our prevention strategy aren't adhered to, right? And so I think the registrar's office is a good example of where masks were worn, which is great, and I have no doubt prevented more people from getting sick than currently did. But masks by itself, it's not a foolproof strategy. We really need the other legs of the stool. We need to maintain 6-foot distancing. We need to make sure that people, even with mild symptoms, are staying home and not introducing virus to a congregate setting. So I think when all of those things are done in concert, we can have confidence that transmission is really going to be minimized. But when only one of them is done, you can see, as we're seeing here, that transmission is still occurring.
Okay, with that, thank you, Dr. Avula, thank you, Mayor Stoney, and thank you all for your questions. Please feel free to follow up with us if you have any more. And this concludes our briefing.
Thank you, everyone. Stay safe, stay strong.